So, sadly, we have another Albany County resident that died overnight from the virus. He's a man in his 70s with multiple underlying conditions. My condolences to his family, my prayers and love out to the family, to the other 111 people that passed away. This makes 112 for us now, and it's everyone's hard to take. They're pillars in our community. They're people that we love, and difficult for the families at this time now to get through. So please, your thoughts, condolences, and prayers for all 112 people. As of today, we have 1,737 positive cases of the coronavirus in Albany County. We have 750 people under mandatory quarantine, that's up by 58, and we have 7 people under precautionary quarantine. It pretty much stays the same since Saturday. We went up 49 cases, but again, we did not report anything on Sunday for obvious reasons in catching up with everything. So Saturday there were, like I was saying, we didn't report Sunday and yesterday, so that's the number. And you're going to see that increase because of nursing homes, but most importantly, you're going to see a little uptick too because more and more people are going out. We remind you to social distance. We remind you to cough into your arm. We remind you to clean your hands. We have now 4,611 people that have completed quarantine. Of those, 1,359 tested positive for the virus and have recovered. That's an increase of 19 recoveries since Saturday. Unfortunately, we went up 5 in hospitalization. We have 25 people in the hospital now with a hospitalization rate of 1.43 that have tested positive. Saturday, the average was 1.18. And currently, right now, we have 1 person in ICU. That number drops 2 since Saturday. Over the last 5 days, there's been an average of 18.6 new positive cases. And again, as I remind everyone, the more we test, the more we have the mobile testing sites, the Priority 1 in Gilliland, Albany with essential employees in the drive-through, the Rite Aid on Central Avenue. We're still trying to get people to test. It is starting to slow up a little bit because I think people think this is behind us. It's not behind us. We are doing the right thing. We are stepping into the right direction, and I'm hoping tomorrow we get the good news that we get into phase 2. Our control room meeting was moved today from 1400 to 0945 this morning. We were hoping we were going to get that news today. That we were going to get the green light to open up on Wednesday, but they talked about the matrix, and they talked about a new form that they put out with the medical doctors guiding the governor, and it was all positive, good news. Jim Melantras had a lot of great things to say, General Murphy, Joe Rubito, and the rest of everyone on the phone. So it was a step in the right direction. Our numbers are still going in the right direction, that's what we want. I know Dr. Whalen and I have talked about Memorial Day weekends and people getting out. That's a problem. When you get in large gatherings and you're not doing social distancing, it can affect us. But right now, knock on wood, everything's going in the right direction. It was nothing but a great conversation this morning. And quite honestly, I was a little nervous because I was kind of hoping that either A, we got the green light, or B, I was hoping they weren't going to say, because of certain data, we're taking a step back. But everything's going forward, so I'll be very happy to see the governor's press conference tomorrow, and hopefully he announces that we're going to be able to go into phase 2. But as always, if you need the mobile testing, please call 518-465-4771. To get onto the site. Also, Rite Aid, you can go on to the website for Rite Aid, and same thing with essential and non-essential employees for the drive-through at UAlbany. That number, as always, is 1-888-364-3065. So I just want to give you a little update, but we have, so far with all our testing, we've conducted 1,496 test sites at our mobile testing sites, including Rensselaer County. We've done over 1,300 tests at Rite Aid. So again, going into the right direction and aggressively testing at our levels has shown good things. I'm going to use the dashboard tracker to take a closer look at the data we've been seeing. but about phase 2 and going forward. So as we continue to move in the right direction, it leaves me confident we'll be able to get to phase 2 because of what we're seeing. But I do want to pull that up and talk about a couple things. So the, again, and Dr. Wellen will get into the other stuff, the numbers and all that. And I know when people say I love to bring up the 20 to 29-year-olds in the 50 to 59, as you can see, they're getting close, very close together, neck and neck. And that's a number we don't like to see. But it's a population that we talk about that have no signs or symptoms, that go out into the community, and unfortunately they think they have they don't have any underlying health issues, they have no signs or symptoms, so they continue to spread. So I say to the 20, 29-year-olds, please go out and continue doing what you're doing, but wear a mask, wash your hands, cough into your arms, and keep social distance, and thinking about the seniors that are in your life, and please, by all means, please use precaution when you're out around people. Get into the numbers here of the males and all that, and I'll let Dr. Whalen talk about that, but I just want to say total persons tested so far have been 24,764. That tested positive, 1,860 for a positive result of 7.50. So, again, all good stuff going in the right direction, and, and the zip codes and all that, and then you see as we, hopefully that number starts going down the other way. But again, it's good stuff, and that's what we want to continue to do, to continue to get into phase 2, so we can get to phase 3 and get to phase 4, where we kind of get back open and get on the right track. So it's important that we see this percentage, a positive, steadily decline in number of people tested increase as we move forward. That's helping our case going forward, so we can continue to move in the right direction, which we are doing. So thank you to everyone out there. But I'll let Dr. Whalen do the rest of it from here.
Sure. Good morning, everybody. So as you see, our numbers, when we look at the epi curve, continue to remain on a downward slope. We did get a little bit of a blip this morning in cases, and our staff is actively doing the case investigation today, so I should have a little better idea tomorrow of what it looks like that may have come from. Geographically, we still see the bulk of the concentration in and around the city of Albany. And as the county executive mentioned, the age brackets are pretty much the same, with those in age 20 to 29 and those in 50 to 59 being the highest rate of positives currently. When we look at gender, it's pretty much split evenly. When we look at race and ethnicity, 49% of our cases are white, 22 are Black or African American, 7% are Hispanic, 9% Asian or Pacific Islander, other. We still have an issue with people that come forward for testing that do not want to declare their race, so they ask to leave the box blank, and so that doesn't necessarily help us with a data capture here, but we still have pretty good data in terms of what the racial demographics and breakdown look like in Albany County. When we look at data for deaths, we continue to see that highest in our older age demographic, as well as, and that's from 50 to 74, as well as those hospitalized, current, ever, ICU, and this is, out of proportion to the demographics. So we know this is, COVID has disproportionately high rates of complication, ICU, hospitalizations, and death in the older age group. When we look at it from a racial perspective, we also see disproportionate numbers of hospitalizations and ICU in the Black and African American population. So Albany County statistics from the state perspective, the percent positive continues to go down, which is a good thing. So we are despite the number of tests we're doing, we're seeing less people come back positive, and this is a number we continue to follow, and hopefully, that daily trend will continue. As we look at our numbers for Albany County, you see there was a spike in testing, and the test percentage still stays low.
So thank you, Dr. Whalen. I wasn't sure if you were done, so I just wanted to make sure before I took over. I just want to remind everyone, as we continue to reopen, and hopefully we get the green light for Wednesday, it's going to be a different world out there. It doesn't mean everything goes back to normal. It doesn't mean that what you had in your life before, the way we operated, it's going to continue to go that way. It's going to be some time before we can drop the mask. It's going to be some time before we tell people to stop staying 6 feet apart from each other. But we need to continue to do this, to stay open, to go in the right direction. So I want to thank everyone for that. It's challenging times, and I've talked to a lot of youth over the weekend, and I get it. This is the time. This is your memories. You're growing up. You're graduating from high school. You're going off to college. Graduating from college. And I guess I get it. The uncertainty of where you're going forward, job-wise, or everything else in your life that you strive for is changing. And but you're resilient, and you'll continue to do great things and be an inspirational, just not to your own peers, but to the younger generations and the older generations, by being part of the solution, not part of the problem. So thank you for all that. But I know as the year ends, and I know right now a lot of seniors be looking at proms, tuxedos would be getting rented, dresses would be getting on, and be going out celebrating their senior proms or junior proms. And I know it's changed, so we kind of talked about it a little bit, and with PAL and all them. So if you go to hashtag Albany County Stay Safe, by Saturday, June 6th, we'll pick the winners. But we want your pictures for the people that have the best prom dresses on and tuxedos. If you get up, we're giving you a reason now to do it. If you haven't tried to figure something out doing virtual, but please, it's a challenge to you, all you seniors and juniors, to any. I'll tell you what, to anyone in high school that wants to get dressed up and and have a reason to do it, we're giving you one. And if you get picked as number one, you'll get a $25 gift card. So also, and from our winners from week 1 of the challenge are posted, the slides up. So thank you for the 2 winners there. You did a great job as always. And please just continue to do what we're doing to go forward. But our mental health support line is always available 7 days a week, 8 a.m. to 8 p.m. 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. And as always, our United number, United Way, 211, and the New York State hotline at 1-888-364-3065. And again, thank you to everyone out there for being part of the solution, not part of the problem.